Hi, my name is James. I'm a clinical mental health specialist, and thank you so much for joining us on this podcast. In this particular podcast, we are focusing on students with chronic diseases. What we are going to do in this podcast is to explore the lived experiences of students who are having chronic diseases, and we also intend to bring experts, like clinical experts, counselors, and the faculty to join us in this discussion. Today's discussion will be based on stigma and resilience in mental health. To help me do this particular discussion to make it quite successful, I have two guests in the studio. So first, I would like my guests to introduce themselves.
Hi, my name is Tufo. I'm a heavy-duty mechanic.
Okay, thank you.
I'm also Georgina, a student of Kane University.
Okay, so thank you and welcome to this podcast.
Thank you.
Thank you.
Okay, so you realize that today's topic is based on stigma and resilience in mental health. Research has actually said that 1 out of 3 students or 1 out of 3 people who are diagnosed with mental illness happen to experience stigma. And we know that stigma is one of the social problems that affect persons with mental illness. Stigma too has been coined to be a particular negative beliefs, attitude and behavior that people exert towards people who are actually perceived to have mental illness or even have mental health conditions. So I want to start with you, Mr. Tufo, that why do you think that society discriminates or they stigmatize persons having mental health condition?
Thank you. That is quite broad. Ordinarily, people will wish to let anybody at all measure up to themselves. So therefore, if you are unable to measure to they themselves, then that is where it becomes problematic.
Okay.
Here, it will depend on the situation or community or wherever one
Finds himself.
Yeah. For example, if you are in an institution like KUST, for example, academically, your colleagues will wish that you are at a level that they will accept. To peer pressure, because you are all doing the same things, you are in the same community. The way you carry yourself,
Okay.
to the wish that you go along with them. So that if you have some difficulties, ranging from finance, maybe character-wise, and all the rest, that is where this problem begin to appear.
Okay. So what you are trying to say is that for those who have the mental health problem, you have mentioned what may contribute to this mental health. But you know that when someone is actually diagnosed, people have different reactions to them, right? So I want to ask you that, why do you think that people have these different reactions when they hear that somebody has a mental health problem?
Yeah. One need to understand what is mental health.
Okay.
If you do not have a basic understanding of what mental health is in itself, then you can expect anything at all. What do people associate people who have mental health with? They don't think it's a kind of disease that can happen to anybody at all. They don't think it is because somebody out there from your family is doing the African thing. They don't think you're supposed to be. So there are a variety of reasons why people might be uncomfortable with you.
Yeah.
So even before they accept that you have a mental health issues, they need to have a basic understanding
About it.
of your situation.
Thank you so much. Sister Gina.
Yeah.
Yeah. What I'm trying to ask is that generally, why would you think that others would discriminate or stigmatize people with mental illness?
Yeah, it all comes back to the point that people have less knowledge on mental health. They don't, yes, they don't understand how or what actually causes or triggers these conditions.
Okay.
Yeah. But if you really know about it, you don't really stigmatize people.
Or
Yes.
discriminate.
Yeah,
That's actually
discriminate
true. What Mr. Tufo was trying to say, he was trying to talk about the cultural factors that
Yeah.
plays a key role in our society, where, I mean, we have specific behaviors that people should exhibit, and anytime you are out of that behavior, it's likely you can be discriminated. And then also he stated things about religious beliefs and all that, and that is actually true. So coming back to you, Mr. Tufo, you have been a father, and you have had a son who has had a challenge with mental health condition. And what I want to ask is that the first time or the initial stages when your son was diagnosed with mental health condition, what was your feeling? What was your thinking? How was it for you?
It was quite uncomfortable.
Okay.
It literally brought a lot of confusion in my home.
Okay.
Because we are living in a household with different people and different beliefs. So for the fact that all the other children have been to school, none of them have had issue of mental problem, and it was initially reported to us. The way the whole matter was carried about in itself also gave us a lot of trauma.
Okay.
Because we were in the initial stage where we needed to accept that our ward had a problem.
Yeah.
That was our first time in our lifetime to hear something like that.
Yeah.
So we needed to actually seek for medical help for them to actually tell us
what is the problem,
what the problem is, and what we should expect thereafter.
Oh, thank you so much. Okay, so for you, Gina, you have also been a student in KNUST.
Yes.
And finally, you're almost about graduating. You have also had your equal share of mental health condition. And I want to ask you, the first time you were initially, diagnosed with a mental health condition, how did you feel? What were you thinking? Can you share with us?
Okay.
Yeah,
so I was feeling very nervous. Okay. And I didn't have any idea about it because I had never heard about that before, yes. So when I didn't accept it. I remember fighting with some of the nurses that I'm not sick. They should allow me to go home. Yeah, because I'm fine. Everything is fine. And they were complaining about me talking excessively. And I was like, oh, I'm a normal talkative. Like, I'm a talkative. I'm not a quiet person. So if I'm talking, then it's normal for me.
You.
But them being health experts were like, no, it's not normal. Okay. So it wasn't very easy taking it.
Well, Gina, back to you. You know that when someone is diagnosed with a mental health condition, it's likely to affect certain areas in their life.
Yeah. So
for you, which areas would you say that when you were diagnosed or when you had the condition, it affected the specific areas? Yeah. So I need you to share with us.
All right. So first, it affected my academics.
Okay.
Yes. Me being a student, I should have had a peaceful mind to focus, concentrate, learn, and better myself. But here comes the case that there is a sickness, there is a condition that I'm going through, and it's distracting me. Yes, so it's really affected. It even got to a point that I had to defer, stay home for a while, then come back and continue my education. And health-wise too, I hadn't been somebody who had always been to the hospital or been taking drugs. But here comes the case. Now I have to be taking drugs every day, going for injection, going for review. And it wasn't so easy. So if it affected my health side too.
Okay.
Yeah. And religiously, yes. kind of, for me, when I was undergoing that, I thought, I don't know how to put it, but I thought I was rather having
a religious experience.
Yes.
Okay.
This experience that God is trying to tell me something, and that He's sending me on a mission. Yes.
Okay. Yeah. So it seems Mr. Tufo wants to say something. Mr. Tufo, what was the impact for your son?
The impact.
Yeah.
It's in twofold.
Okay.
You know, here is a family who have given us, we've given our all to send our kid to a university.
Yeah.
You know, times are hard. And in our books, we think, we have 4 kids, we think the first one will go, and then in the next 2 years, the others will follow. Here comes a situation, the first one has gone, then there's a problem. He cannot go. The financial, the monies that we needed to use to fend for
the other kids,
was significantly affected. Because here is the first kid who has gone to school, he couldn't continue. We are using part of the money at the same time to take care of him. And the others who are also coming to, they need to benefit from that same resources. So whilst I was taking care health-wise on the first child, those who were following him had to wait. And because they were sitting in the house and they were not going to school, it also brought a lot of pressure on the family. Eventually, when he came home, to another pressure came and added to the pressure that we were experiencing before. Because people began to ask, why is Mr. Tufo's case home? Why are we home? I'm a mechanic too. I need to go
up and down,
fix 1 or 2 things. And because they are heavy duty machineries, they are not in Kumasi. Some of them are in the outskirts of Kumasi, or even outside the region of Ashanti.
So that means you have to travel out.
I have to travel out.
Okay.
So
in other words, you are talking about how it actually impacted the family.
Yes.
From your perspective, you are talking about the financial burden that came with it.
Psychological. The psychological was coming from the fact that people were trying to find out what was happening.
What was happening.
And because of our understanding of mental health, we had agreed among our family that we were not going to release information
for other people.
To hear. We are not even sharing information to close relatives.
That would be a very tough one.
So it became like a kind of unusual.
So it's like all of a sudden the system within the family had to change. The dynamics
changed completely.
Had to change. Okay, but for your son himself, what was the impact on him? Definitely, he might have shared it with you.
Yes. So the first thing he told me that he was experiencing a kind of religious, what do you call it? This
hallucinations.
That hallucination was experiencing that something a bit unusual and was relating it to his religion. He thought God has given him a mission, and at a certain point, he was telling me that he has been crowned as another Asante Hene. So I needed to help him so that we go visit Asante Hene so that he would tell him of the mission that he intends to do. Even before I realized he had already gone to Asante Hene's palace. So I was lucky somebody out there gave me a call and told me that my son had come to them and I should come and take him away. So eventually he went to Asante Hene's palace. So it was there that I realized that
there's something wrong with it.
There was something very, very wrong with my kid.
But academically, what would you also say? Because he was in KNUST, he was studying. I think he was a level 200 by then.
Immediately I sought counsel from one of the counselors.
Okay.
To tell me the way forward.
Okay.
Then he told me that with mental health to take some time.
Before.
So he shared with me somebody else's experience.
Okay.
So we had to write a letter to defer
the program.
Yeah. And we had to come to Dr. Frimpong to help us. So he directed us as to what to do. So eventually we got that.
Yeah.
And he was deferred.
Okay. So that tells us that initially it becomes a tough one for both the parents and even the individual who happen to experience the condition.
Exactly.
And so it changes the family dynamics. It brings about burden, financial burden, psychological burden, social, because sometimes, just as you said, you are trying to protect your family so that people outside of the nest will not invade, and then also to stigmatize or discriminate even your son. That's a good move there. And then I think for you, at least you had a counselor to even help you through the navigation, you know. But Gina, what I want to ask you now is that was there a point in time where you were actually discriminated or someone stigmatized you or you were labeled, you know, because normally when you have mental health challenges, it's likely whether your roommates or your classmates or some other group of people within the university will get to know, and they may behave some way different, you know, towards you. Did you ever had such experience?
Okay, so for me, I never had that experience because I'm one of a kind. Initially, I was shy to share. So if I don't tell you, you will never know. Mostly I'm quiet, just isolating myself because I had not accepted the fact that I was suffering from that condition. So people didn't get to know unless those who knew it when I was on the sick bed. That was it. And they were family. They were friends from school. I mean SHS. So they accepted it and they never discriminated. But in as much as I'm saying this, I think people have problems with their roommates, or roommates with people with these conditions tend to discriminate them, or even they go to the extent of telling
others.
Yes, others about the condition, that I have a friend in my room and she's going through this and I can no longer stay with her. Yes. And it gets to the extreme that they even report to authorities in the school that they don't want to be roommates with them anymore, making them feel very...
When that happens, you'll be so isolated. And this is the discrimination that we're talking about.
It's not easy.
So, Mr. Tufo, what about your son?
Let me add on to what
in the right direction.
My ward also had a similar experience. Originally, there were 3 in a room, although it was meant for 2. So the third person, how he got in, I had no idea. He left on his own. Then his roommate proper decided not to sleep in the same room when my ward comes to lay on bed, because he was also afraid that anything can happen, because he was probably being influenced by other people, either from within the school, outside, or even from his own family. I don't know how that got in. So it aggravated my son's problem. Here was a situation that he said he would not be able to live all by himself in the room because they were sharing a lot of things. Maybe cooking together so that they will reduce costs and all the rest. So it was putting pressure on his finance. He literally needed people to go along with. And everybody
wanted to move away
from him. So he realized that self-worth, he has no worth. So he wanted to move out from the institution. At that point in time, I realized he had not relapsed. It was a genuine problem. Whatever medication that they were giving him was working. But this was an external problem that was affecting him. So I needed to understand him. So I pulled him out from school again, deferred. He received another medication or medical care for the whole academic year. Then I tried him on the subsequent academic year.
Oh, yeah, okay.
Then when it was midway through, the same situation happened with a different student. So I realized I was not going to go anywhere with my kid. So the best thing was to withdraw him completely
From the school.
and make sure that he's completely healed.
So from what you just said, it looks like the triggering in terms of the relapse was actually coming from other students who were
initially that was the first arm of the problem. Then when he came, a similar one also happened. Here is a big community that his age mates, all of them, are in school.
Yeah.
Then you are not in school. And once you take this medication it depends on the dosage. Unless we are pretending, you will not be all right. If you know that folk or that fellow very well, his facial features will not be the same as you used to know. So people began to suspect
that what is actually wrong with this guy.
And he was not lucky. People even thinking he has started smoking weed. People thought there was all sort of things that people were saying. So eventually, I have to ring fence him.
You want to shade
market areas that he will go or not go. Initially, it was okay. But as he was improving, he began to ask me questions why I was limiting his movement.
I didn't actually know you were protecting him.
And I was also protected. So there too, it became a problem. So his situation was such that depending on whether he was improving or not improving, it was giving us different scenarios. That's why I stopped working and decided to sit in the house.
To take care of him.
Take care of him and do proper observation.
Okay. I think that's quite fantastic with the efforts that you have put in as a parent to make sure that your ward actually recover. We'll come back to that. But what I'm curious about is normally when people have mental health challenges, we started with discrimination, generally how people perceive it. And then we did say that people think sometimes it's as a result of evil spirits or being possessed, or probably there's a curse on you. People have all sorts of ideas about why people have mental health problems. So the first thing they do is to send them to prayer camps for them to be prayed for and delivered. We have all sorts of ill treatments that have been recorded in research papers and that have been documented about how, some prayer camps, deal with these people with such conditions. You are a Christian. You could have opted for a prayer camp, but you decided to come to seek for help through the counseling units, and then finally you came to the mental health clinic or the psychiatric clinic within the hospital. What informed that option for you?
It is a complex one. Because originally when it came, I also had this influence coming from my wife.
Okay.
That she thinks it is a spiritual affair or matter. So between my wife and myself, we have to settle that one. I believe in science. I have seen it work. I know a couple of guys who went through that, but I was not too close. So I observed them from afar. So I realized that later that they got well. They got married.
Okay.
And everything later was fine.
Okay.
So I was coming from a background of knowledge, information, ideas.
Okay.
I don't know what my wife knows. He also have her own friends who are also telling her something else. So we needed to settle that one first. But because I am a man and I had upper hand, I used my muscular power, moved my ward from the home, and we came to seek for solution from the hospital.
Yeah. Well, thank you so much for that. I think it's quite an insight, especially when you have a spouse and everyone has a different perspective about which, treatment you should go for, whether you should look at it from the spiritual perspective or look at it from the orthodox perspective where you seek help from a psychiatrist or a mental health practitioner to help you. So we are happy about it. But in addition to that, to what degree will you say that there has been improvement so far for your son?
His improvement has been tremendous or very significant.
Okay.
Initially, he would not go out when I thought he could do that. That is where the stigma came. So I said, okay, if that is the case, I have a car, I will send you to driving school because I think we're okay. And if you also think we're okay, let's go to a driving school.
Okay.
So I put him in a driving school. So he did that, he qualified. I brought him back home. Then he needed to skill the others because I think there are several things that was affecting him. I didn't know all. But some of these things are within him. If you don't push him, you don't get it.
You don't bring it out.
Yeah, he doesn't bring it out. So I realized he was still not okay. Something else was wrong. So, one, he would not go to church, and he would not assign a reason to that. Those things that he used to do does not interest him any longer. Also because he thinks when he goes there, something which was unknown to me will happen.
Okay.
His friends decided not to visit him for whatever reason. I have no idea. Then the family, extended family. Because he has other brothers who were also in school. Originally, they will call and they will talk about whatever things that they experienced when they were in school. It was a normal thing. I saw him doing it. Those things ceased. They were not coming. So there was this feeling of inadequacy. He realized that he was not up to something. That was where people...
So like some form of low self-esteem.
Feeling of inadequacy. So, Daddy, what is wrong with me? I said, there's nothing wrong with you. So there was this challenge. So the next step I did was, okay, forget about your friends.
Sure.
I have my store in the magazine. These are the keys. I still think you are okay. I have so much confidence in you. Go open the store and do the sales.
So yes,
that's why he's still calling me now. He's doing the sales.
That is quite fantastic. I think
it will take time, but it has improved tremendously.
Yeah. Thank you so much for sharing that. Gina, for you, you have also had, just as you started sharing about the fact that you are not being discriminated, you didn't understand what was actually happening to you. Why do you also, because I know you're a Christian.
Yes.
You could have, decided to say that, listen, I'm seeing one of the prophets to actually pray for me and to deliver me from all these type of mental health conditions and then the symptoms that you are even experiencing. But you got stuck to the orthodox by coming to the clinic and by receiving treatment. And what informed that? Why didn't you do it spiritually?
All right. So I had guidance.
Okay.
That is it. I had guidance. Initially, I was taken to a church to be delivered. Yes. I've been delivered.
So it actually happened to you?
Yes.
Okay.
It happened in class. I've actually forgotten, but somebody told me the whole thing and I'm repeating it. It was after class and I went to one of the TAs and I think I was saying a whole lot of things to her. So she realized I wasn't fine and she took me to one of our lecturers And there too, I was talking plenty, saying a whole lot of things. And one lecturer, the lady lecturer sent me to another lecturer.
Oh, that's a whole
who is
transfer.
a Christian too. And she was the one who sent me to the church.
Okay.
And then they delivered me, prayed for me, and then we came back. So when I went back to my room, I think I was still doing the same kind of things that I was doing. To me, I thought I was fine. But that was when one of the hostel manager, she was a cleaner. She noticed it and they reported it to her. And she called the director and they called me, sent me to the dean of students. And we talked a whole lot about things and they assigned me to a counseling
department.
Yes.
So it was from there that you came to the hospital.
So I was following the counseling unit. For me, myself, I wasn't fine. So I didn't know what to do.
Okay.
But I was just directed to follow those treatments.
Okay. So far, what would you say about your own improvement? Because I know you have improved fantastically.
Yes.
Yeah, but it's not for me to say. It's for you to talk about it. So I think maybe you can share that.
All right.
Before she does that, can I chip in this?
Okay.
Now, that other part came in. What am I talking about? The deliverance part came in. How? Why? I think that is what you might be asking. And this is real. Then my second word. This time I had enough money. I sent her to school. This time she's a lady.
Okay.
Whilst I was following the male child, thinking that he was improving, then this female child also left school. For 1 month, we didn't know where she was. We went to this institution to inquire that she was not there. People didn't even know her because I think when she stepped in, she left her things and left.
Okay.
Finally, somebody told us that she was in Accra. And here too, when we brought her, she also started experiencing a similar situation.
Okay.
So I was tore apart. Not me, I and my wife were tore apart.
Yeah,
this is the point that I changed the way that I was reasoning.
Okay.
The science part was not working now. Because what sort of science is this?
That it affects another person too.
So I have two people at the same time experiencing the same condition. Yeah. So
sometimes
my first half believe in the science, my other half also believe in spirituality.
Yeah. So just as you are saying, I think sometimes you come to that dilemma where as Africans, you are like, no, if something happened to my son and it's beginning to affect the next person that you have, which is your daughter by then you tend to say that, no, it's better if I seek a higher power. But or in addition to what you are trying to say, I'm very sure that both of them are quite okay currently.
Yes, she's also, one is about 8 years, the other is about 6 years. Okay. So I've been sitting in the house, managing 2 people with mental issues.
To mental health
If you leave me for the whole day, I will talk and talk.
Yes, I know. Okay, so we'll come back to what Gina was. Thank you so much for that insight. So Gina, your improvement, as I was saying, you have made a tremendous improvement. So share that with us.
All right. So I can see that I'm now fine. It started when the day I told one of the nurses that I know I'm healing. Okay. So that was the day she told me. Then she can see I'm now getting. Yeah. I'm getting well, yes. And from there, I could concentrate on education, education-wise. And I was still adding prayers. Even though I was taking my medication, going for review and all sorts of things. I was still taking and now I can feel better. And I feel I belong now.
Okay, you belong too. Okay. Now, Gina, I wanted to ask you this. I think I forgot to ask that. Because Mr. Tufo shared that of his family, I think I want to bring you a little bit back. So you were diagnosed and then you have shared with us already your interpretation about it. But what about you? What was your family trying to say?
They were in terms of the healing, whether signs or...
No, we'll come back to the healing, but what was your family trying to say in terms of when you were diagnosed with the mental health condition?
Okay, so they didn't accept it.
Okay.
They didn't accept, and it became a sad moment. They were like, why did it happen to you when you entered university? Because I had my first semester when I came to school, fresh. I mean, the first semester, getting to examination period. That was when I started. So they were like, it's because of the school that I've come. That's why all these have happened to me. Yes.
Okay. But did they make any suggestion as to how you should be treated?
Oh yes, later they understood the counseling units. They talked to them, advised them, counseled them, and they understood that there's a condition, there's a mental health condition, and people can always, anybody can undergo that. Yes. So if I take my medications, if I go for review, if I manage myself, I'll be fine in the later on.
Okay, that's quite fantastic because it's very important that we know how your family thought about it and their perspective concerning.
And they were always along.
Health.
They were always with me.
Yeah. So from what you have shared and from what Mr. Tufa has shared, it seems the counseling unit has been very instrumental in helping people or students who experience mental illness to navigate through the healthcare system so that they receive total support throughout. And I think they are doing a very fantastic job by then. So kudos to the counseling unit in KNUST. Yeah. But what I want to understand is that the journey of recovery is actually not easy. There have been ups and downs for each of you. And but you have been able to prevail. So starting from Mr. Tufo, I want to know how you came to the point of acceptance, how you help your own son to navigate these challenges until this time, in brief.
It is not a straight one. I'm somebody who's generally very confident.
Okay.
You can see the way you ask me that I should come and give a helping hand, because you wanted to actually engage me on matters concerning mental health. And straight away I say, no worries, I'm coming. You call me to find out whether I'm there. I say, I'm already there. Something like that. If I say I'm going to do it, nothing stops me.
Okay.
So here is the situation that I have two walls who are both experiencing the same thing. Pressure is mounting from outside our home, within my home, and it's affecting my business. Literally, all my brothers are not even talking to me. And the few who come, their mannerism alone
will tell you that there's any signals.
Something is wrong.
Yeah.
They talk to you, and it's like they ask them questions, they will not. They ask you questions, and they want you to talk because you can see that there's something wrong. When there are family meetings, they will do it behind you. I know they are thinking about a lot of things, which is outside my own understanding. But still, some way, somehow, I'm somebody who believes.
Yeah. So, in other words, you I think in your earlier submission, you said something about trying to tell your son that there's nothing absolutely wrong with you. You can do it. And those are the things we wanted to hear from the parents about how they can actually support their children who are experiencing mental health conditions.
Before I come to that, if you wouldn't mind, then there was this other issue that popped up, because my wife believed in the spirituality and wanted to damn
the medication that we are giving.
So I say, if you believe in spirituality, I also believe in spirituality. So I'm going to tackle both head on.
Yeah.
So quickly, I hurriedly prepared one of my rooms as a church house. Put all the things that any church will have within itself, like the cross, the rosary, everything else.
So you guys
that
can
when you enter that room,
you can fellowship
you
there.
Fellowship there.
Yeah.
So instead of we visiting pastors or whoever, I said they should come if they believe they can help.
Yes, for you guys to pray.
Yes, we pray
over there.
So as I sit here, I'm a sport pastor in my own way. Every morning we do the spiritual thing. We pray, we read the scriptures. I try to explain it to them, and we have difficulty. We write it down. We invite a resourceful person to come, and educate us on or fellowship with us. So my wife is cool with that. Now back to science. Then also listen to counseling from some of you. Also spend a lot of time to study them, because they are not the two. They are not the same thing. It's one problem, but the reaction from
it is different.
It's different.
Yeah.
So I needed to understand the girl. I also needed to understand the guy at the same time. So I worked out a plan for the girl. I asked her what she wanted to do. She said she wanted to do the hairdressing beautician. I look out there in the open. I realized that it was not going to work. So I had to spend about 2 months to come around Kumasi to look for the best place that would be convenient
for her.
Not just any place. So I realized I had a male hairdresser who was carrying out his activities in, what do we call it? This housing. How do you call it? Hija housing. No, it's a secluded area. It's like a home. So whatever happens there is just within.
Yeah.
So I sent her there. Initially it was a problem. But as I encouraged her to continue to ply her trade, she's now okay. And just last week, when her boss was leaving to Accra to perform something else, my ward was selected to lead the team. Wow. And as I speak, he's still living there, he's not coming home. Because as at this point, she has been so very useful.
Wow.
The only challenge she has is that she's grown a little big. And that in itself, I think, is affecting her. Yeah. And she thinks it is because of the type of drugs
she's taking.
So any other time that we meet and we try to talk about the same condition, the first thing she will ask, Dad, when am I stopping that drug?
The medication.
As if you are okay, you stop. Communication then becomes a problem. So I am not okay. Then sometimes. Then now I'm very careful the way I also talk to him. I've realized that I cannot just say anything.
Yeah.
If you watch me carefully, I choose my words, even as I sit here. That's not the way I used to be. This time, when I'm talking, I'm very careful. I'm selective. Yeah. I used to talk blah, 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 like that. But this time, I measure before I talk. So now the communication has improved.
Yeah.
And I found some different ways to tell her about the same thing. Now she knows, I know she's okay. Yeah. And that alone makes her feel fine. Okay. And the male too, he's also improving.
Yeah. So Mr. Tufo, I have from all your narrative, it looks more like from your narration, it looks more like you have been the backbone for these two kids. For you, you are their counselor, you are their pastor, you are their friend, and you consider to even be a father in addition. And I think it's in the right direction.
Thank you.
So that is where we say that you have gained not just, you have taken charge, of the health state of your wards. And you're trying to help them to make sure that they achieve, just like any other student out there can also, have all those desires to achieve in life or goals to achieve in life. So thank you so much for sharing. With Gina,
okay.
When it comes to, just as I said, when it comes to the going through the journey of recovery is an ups and downs and all that. But you have made much progress, as I told you. You have made much progress in your health. Share with us how you were able to overcome this negative challenge. In other words, I want to know how you were able to cope, your resilience and all that. Just share that with us.
All right. So to start with, I started admitting that I belong.
Okay.
Yes, I belong and I'm part. Even with the illness or with the condition, I'm still a person. Initially, I didn't have that feeling. I thought being in this situation means you are not part of, like there is a low self-esteem. But later I Googled, yes. I Googled to search on the jobs that I can do, whether with this condition, whether I can still pursue my dreams. And I had the answers right. They were like, yes, I can still do whatever I want to do. Yes, provided I manage myself. And after accepting the fact, growing out myself that now I'm fine and I belong, I started heeding to the advice of the counselors again, because initially they told me I should be taking my drugs frequently, be visiting, be going for reviews, and I continued with that. And I had this mother figure too, who had always been a backbone, always trying to be on point. Whenever I go through, if I'm having sleepless nights, I call her, I tell her that mommy this and that, and she'll be like, come to the clinic tomorrow or do this, or I'll be there and the specialist, you call me, you'll be like, I should come to the clinic tomorrow, you want to see me. And through all these processes had helped me build this self-esteem again. Yeah.
So in other words, you came to a point of accepting that this is the condition.
Yes.
And then at what point did you take charge of it? I mean, you took charge of your own health to say that, listen, I need to be well, these are the things I need to do.
All right, so when I got to know it's me and it's me, and nobody else will do that for you, that was when I took charge of the whole thing, because I got to know this is me and something I never expected had come my way. Then what can I do about it? Because if nobody is trying to help or support, what can you do? You have to take hold of it. Because as an individual, if nobody does something for you, you tend to do it yourself. So that brought the idea of helping my own self heal and heal completely. Okay,
so thank you for sharing that. You talked about the fact that, Gina, you talked about the fact that you had a surrogate mother who was supporting you. And then also you had your mother herself supporting you. You had other healthcare professionals. You need to tell us strictly how we, the healthcare professionals, how we have contributed. Because I know you normally come to the clinic, and the clinic is made up of a team. So share with us, how did we actually help you? In what ways do you think that we actually help? When I finish, I'll come to Mr. Tufo to share with us how the psychiatric clinic at KNUST Hospital actually help you to recover, or through your recovery journey. Yeah.
All right, so the observance, they observed my movements. They made sure everything that I do was recounted on to see whether I'm fine or not. And they advised me that whenever I have anything bothering me, I should let them know. And so I'll call, mostly I call the nurse. So I'll call her and tell her, maybe today, I've not taken my drugs for a while, but I think I'm fine. Then she'll be like, no, Gina, you have to take your drugs. Come to the clinic tomorrow. I have to see you. So those promptings were good. Yes, they were very good. Yeah. And also they were giving medications. The medications too were not, I wasn't paying. That's also another.
Helped you?
Yes.
Oh,
because
for students,
financially, it's supported.
Yeah. I think the psychotropic medications are somehow expensive.
Very expensive.
And KNUST subsidizes these particular medications for students. So for free. I mean, sometimes they come. Even your consultations are free. Which gives you the opportunity to say that, listen, you can walk into the clinic anytime. But we were supposed to book you because we see students on Tuesdays. And but despite the fact that Tuesdays are for students and for staff, we give you the leeway, the opportunity to say that, listen, if there is something actually happening to you, if you feel like you cannot sleep, you're having problems with academics, you're not able to concentrate, you're having some form of anxiety, you should come anytime. So just as you are saying that the nurse has been very consistent, interacting with you, engaging you, and you can just call us at any time, you know it. Yeah, so one way or other, you're trying to tell us we are reliable.
Yes, very reliable.
Okay, I want to come to Mr. Tufor. Mr. Tufor, what's your view about, or your own experience with us at the clinic?
Mine is somehow different from Jeanette's.
Okay.
In fact, they are at par. Originally, when the male child, when he was here, I had a lot of subsidy. So money-wise, it was okay. But when it became problematic, and then I removed him entirely from the institution.
So that means that from there you have to start paying. Yeah.
So I must tell you, it's difficult. Then when the lady child or the girl child who had the same problem, it means when I'm coming to the clinic,
you need to pay for 2 people.
It's times 2.
It's a double thing.
Double. So I'm a double man. So sometimes when I come and meet parents with just one and they are making noise, I stand somewhere and laugh. That's why people are joking. This is serious. So financial wise, it's a huge problem. And my time, I'm the same person, my wife is not working, who have to go out there and work and bring this money. But I cannot go. My wife, even my kids are even bigger than her. I've got a smallish wife. So physically, she cannot control them. And we cannot also, even if somebody wants to offer us help, because of the stigmatization factors, we don't need him. So I need to be at home all the time. That's why I'm saying for 8 years, it's magic.
So
it's a huge problem. That is problem number 1. As for the health facility, what else do you expect? You guys have given us your all. Except if I wanted something that you can deliver. And that is what I told you. You guys won't pay off my bills.
Yes, sure.
That is what you can do. Otherwise, I don't have problem with you.
What I'm trying to ask is, you have started the conversation around that. In addition, what I wanted to know is about what has been your experience with us so far.
Experience, it has been friendly from Dr. Frimpong to the other Dr. Calip, even to you and what do you call it, Godfred. I haven't called Godfred yesterday. I'm coming to see IUC on what? I said, don't mind IUC. He wanted me to come and talk. That should tell you the level of rapport that I have with you guys. Dr. Frimpong, when my kids are coming, for example, with the other guy, the male child, he even comes with loads of stories. Don't worry that when we get there, I have this story to share with Dr. Frimpong. Because Dr. Frimpong normally asks my kids for a lot of these old folklores. And I think he's enjoying them. So before he even comes there, he always probably prepare himself that Dr. Frimpong will be asking him. Except that he doesn't have time. Because of time constraint this time, maybe they are not asking. And Caliph is not Dr. Frimpong. He also has his own side. And they are enjoying it. The girl child too, she's okay. She has good memories of you guys. Sometimes she will tell me that had it not been, she even tells you guys are her savior. The only thing they don't like about you is the drugs, the medication. When are they going off the medication? If there's any challenge between me and them, or between they and you, it's the medication. They think you guys are so wicked, you will never let them go off the medication. Otherwise, it's cool, no problem. But there is this thing that that is personally. It has nothing to do with my boss. It has all to do with I myself. There was this priest Catholic priest who had an issue, and he came to the clinic. And because I carried my 2 wards there, he was thinking because I'm huge, my 2 ward had carried me
to
the clinic. He didn't find out for me. He went out there and was telling people that probably that is why I'm not opening up. Because I had a challenge. It's huge. I'm managing my case. I'm not going out there. Most of the church activities, I'm not doing that because I can literally leave them. If you have to leave, then they will have to go out. So my movement and several other things have changed significantly. And instead of he sympathizing with me, he doesn't know the reason. And he's assigning those reasons that I myself.
There's something wrong with you.
So I realized that too late. So I decided this time that they've improved to show up more in church than I would normally do. I don't like asking a lot of questions.
Yeah.
I'm an action man. If you say it because the A, Y, Z, then if I have time, then I'll come and diffuse that, get that off. So now I don't know what they are thinking of. So I'm okay now. I'm happy that things naturally is beginning to unfold.
Okay.
And they are beginning to know the better side of us.
Okay. So I actually have a last question, but before that, Gina, I want to know, you see, you have actually mentioned some of the people who actually supported you in this process, which means that when we want to recover, it takes not only us, but we need support from other people to do that.
A lot.
Yeah, so you found yourself within the academic institution. So my question to you is that, did you see any other faculty member who actually supported you throughout the process? Because there are some people who, at a point in time, they may not be able to write exams. They may miss mid-sem exams. You may, because of your relapse, or maybe because of medication. And were you contacting your faculty members? I mean, in terms of the lectures, engaging with them, informing them, or you were telling the HOD? How were you able to do that?
Okay, so I told the HOD when I wanted to defer. Okay. But I think maybe throughout the process he forgot, because I wasn't really close with him. Okay. It was just being a lecturer and being a student, that's connection.
Kind of sure. Yes. That's how it's supposed to be. Yes.
And with some lecturers, I was very free with them. I used to talk to them about me improving, how I'm going on about things and how things are going on. But there were some too who don't understand the condition. They don't understand the condition. Because there was one lecturer, I told him I wasn't very fine and I couldn't write some of the quizzes and other things. But still, he trailed me. I was trailed. I had to come to recite and write. And that was when I met him again and tried to let him know that I was the lady who told him the other time. He was like, oh, okay, fine. You come and write. Everything will be fine. But later, he passed me.
He passed you, yeah. I think so. Sometimes the lectures have a lot on their mind. They may not be able to remember some
they try to add everything up. Okay. Even though they have a lot on their minds, they still try to help you out.
So actually the conversation has been quite interesting, where we started from in terms of general perspective about stigma. We came to also look at how you guys felt or thought about when initially when your son was diagnosed with mental health condition, and then you, Gina, to when you had a mental health condition. You have shared with us how you were able to navigate your way through and how the clinic, the counselors have been able to help you. My last question before we end this particular segment is that, what do you think the university should do in order to reduce, help with, the stigmatization on campus with students who happen to experience mental health conditions? Gina, the question goes to you.
All right. So I think, first of all, education is needed. Like, students should be educated. They should be made aware that people with mental health, it's normal. It's nothing very huge. It's nothing very big that we can't control or manage. We can really control them. And that they should know how to let's say if you get a friend or you come into close contact with somebody who has this condition, you should know how to be of help to the person. So I think the university has to do that, bring awareness to the students so that they will know much about their mental health condition.
So by awareness, are you saying there should be programs like that?
Programs, conferences,
seminars for them to,
yes,
to inform the students,
to inform them most about the symptoms, the healing process, how things go on, yes, throughout.
So that they can understand other people better. What you are trying to say is actually true, because at our clinic we have, many students come in there about different kinds of mental health challenges. So you can start with sleep problems. Some people, they have chronic sleep problems. Others have anxiety, where they are afraid of something that they can't deal with, not only in terms of the exams. Some people also have studying problems and they think it's quite spiritual. Others also hear voices, and that is why they may come to the clinic. Others also see strange visions. We also have a couple of students who smoke, and so we know the dangers of marijuana that takes students away from studies, because it can trigger psychosis, and one way or the other it can be what we call the precipitating factor to start a particular mental health condition in a particular in a student. So we have a lot that students experience, but it seems people are more used to those who take out their dresses and run about, just like it's being portrayed on TV. And it's being portrayed like when you move on the streets of KJTia, you see someone who is in tattered clothes and carrying that kind of junks roaming about. People have that kind of idea about it.
From my experience, what Gina said is okay. Unfortunately, it's not enough.
Okay, so I want you to add that.
The problem is, coming from where I sit, is the approach.
Do you mean
where approach? I'm coming. Okay. Approach. How do you deliver mental health education? Students need to know the triggers.
Okay.
It must be loud, clear, and simple. If you have learning problems, danger one. If you read, you do not understand, and you take it. You see, more than you should. Sometimes he's overly worried.
Yeah.
That are the indicators. If you are overly anxious, overly ambitious, those things, it must be loud and clear. They can write it on notices like this, so that when he himself sees that and he happens to encounter a conditional situation like that, he may either seek for medical help, or that self-awareness in itself will calm nerves. Because my ward, for example, said he felt that spent so much on him, and by almost he needed to blow. I said, blow what? Just to do something to impress me, to impress people who we were living with. I don't know whether the household, because unless probably when it's totally out there, I'll be asking some of these questions. There was something fundamentally wrong with him. Not that he was sick at that point in time. His mindset when he came to school was different. So when he was not achieving that, it began to set in all this variety of problems, because he needed to prove something to who? He needed to get A that you don't get A. It was in first class in the by the time you finish, blah, 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 blah. He was telling me all sorts of stories. It means there's a problem there.
So you think
it's close to what he wanted, he did not get it. What he got, he didn't like it, but he needed to come to the university. So there is a shift of interest. So here is a lad who already is an average student. He's doing what ordinarily.
Yeah, he shouldn't do.
But
because
he
he has no
wanted to
interest.
come to this university because there's that peer pressure, everybody's coming. Then he also follows it. So he's doing something that the interest is not even there. So learning here becomes a problem. So there's a huge challenge there. Okay. So people like us, if you guys continue to talk, I don't know what I'm saying right now because I don't know whether they are proper indicators or not. But I've heard so much.
Okay.
Heard that same thing from the lady child, the girl child, the same thing from the boy child. Same thing. Whatever the boy child is saying, that's the same thing that the girl child is saying. That is why I'm able to know that there's a gap somewhere. Do you expect to actually listen to my story and try to fill in the gap?
Thank you so much, Mr. Tufo. So, in summary, what Gina and yourself are trying to say is that the university is supposed to intensify their mental health literacy program, such a way that students will be able to know the signs of mental illness when it starts. And then also they should learn to seek for help, because the counselors are the first contact you have to make as a student. If there's anything wrong with you, you have to call on the KCC and the KNUST Counseling Center. They are always there 24/7 to support.
You see, the
students.
problem with you, that's why I say approach. No mental health patients think he's sick.
Yes.
So he will not report to begin with.
Yeah, that's true. That's true.
The triggers must be communicated by somebody else. So that when they know, maybe it will not be the same thing.
Yes.
I'm not saying to
blow out of proportion.
But the triggers are very, very
yes.
important.
So with the mental health literacy, when you talk about the symptoms, what happens is that if the person realizes that he's having problems with sleep, we are not waiting until, so that is where he has to go to the KCC.
That's specific.
Yes, to inform them.
That's why now you see the approach.
Yeah.
Your approach is the problem. The people who are delivering the services, the experts, they know it. But the way they are going about it, it's not clicking.
Okay.
So the students do not know what to prompt them to come and seek for help.
Okay.
So if he's not sleeping and it's learning at the same time and it's aware it might affect him, he will come.
Straight away.
Either will stop doing what he's doing or come or do something else.
Okay. That's true.
But the way you guys are going, if you are saying come for help, nobody will come. It's the approach. I have studied the situation using my tools.
To realize that.
Studied it. So maybe outside this program, if you continue to talk to me, you hear a lot.
Thank you so much.
Project, what do we call you? What should I say? You do your own thing.
Yeah.
You add information up and you use it for whatever.
Okay. So, Mr. Tufo, thank you so much for having you as a caregiver who has given us a lived experience and insight into your son's journey of recovery and how you were able to support the family. We really appreciate that. And then Gina, one of the most successful person I know currently, she's about to graduate. Gina, you have also given us an insight about your own personal experience with mental health condition and how stable you have been and your journey to recovery. So we say thank you very much. What we want to add is that let's stop the discrimination. We always know that the discrimination continues, but we want it to end. Having mental health condition does not necessarily mean that you cannot function, despite the challenges that come. We also need to accept that recovery is a journey. It comes with a lot of challenges, but with collaborative support from other people, including the people in the school, the counseling center, the psychiatrists, faculty heads, your parents, friends and family, people that you can trust, you will be able to recover from mental health problem. So I'd like to acknowledge the Directorate of Students Affairs, the Chronic Disease Management Committee, the University Health Service, and KNUST E-Learning Center for their technical support. So till we meet again in another episode, I will say thank you so much and then have a good day.